On behalf of TechBharat team, a very warm welcome to the excellent panelists that we have put in today for this session. The panel will be deliberating on the topic telemedicine in India post-pandemic. Let me give a small brief about the topic. India is the second most populous country in the world with a population of more than 1.3 billion. The number of doctors to cater to this population is not equally high. Due to this fact, adequate and equitable distribution of healthcare services has always been a huge bottleneck. Adding to this mismatch is the recent trend of concentration of healthcare facilities in the cities and towns that includes 75% of the population of the doctors away from the rural India where 68% of the national population lives. And COVID-19 pandemic just added fuel to this unprecedented burden. In this backdrop, telemedicine suddenly gained prominence. Although telemedicine has been used very sparsely in Indian healthcare so far, the COVID-20 pandemic provided the nation's healthcare system an unprecedented opportunity to make a concerted effort to increase access and coverage. We do understand that telemedicine is an important tool that can combat this mismatch and improve the delivery of healthcare services using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers. To dive deep into these very issues, we have together a great panel today. It's my privilege to introduce the speakers. Dr. Sachin Bajaj, Director, Ujala Signos Hospital, Dr. Sanjeev Chabria, HR Manager, Project Step 1, Mr. Shashank Saini, Head Digital Health, Ujala Signos Healthcare, Mr. Krishnan Kasturi Rangan, Co-Founder, Waste Link. Before I hand over to Dr. Sachin Bajaj to moderate the session, a brief introduction of Dr. Bajaj. Dr. Sachin Bajaj is a highly qualified medical scholar. After completing his MBBS from PGIMS Rohtak, he did his doctorate in internal medicines from Dr. SN Medical College, Jodhpur in 2004. He is an alumnus of prestigious institutions like INSEAD, King's College, London, IIM Calcutta, and PGIMS Rohtak is our director. Dr. Bajaj was the recipient of British government's 2015 Chevening Gurukul Fellowship for Leadership and Excellence Award at King's College, London, where he spent considerable time studying the various facets of leadership, its various challenges, and its learnings for India. He is on the board of a number of national prominent NGOs as advisor health programs and has provided and played an active role in the healthcare track of Zintio's India 2022 coalition, as well as being part of the HelpAge International Regional Research Initiative on Older People's Health as the academic partner of the International Health Working Group. In addition to numerous other awards and accolades, Dr. Sachin has received the Worldwide Achievers Healthcare Excellence Award 2014 for Healthcare Excellence in Internal Medicine in Delhi and NCR. Best Consultant in Internal Medicine in Delhi 2012 by the Times Research Media Foundation. National Award for Excellence in Healthcare 2015 for Fastest Growing Healthcare Chain in North India, along with 2015 Leaders Award. Dr. Sachin is an avid healthcare investor and is associated with multiple health tech companies as investor, board member, and mentor. He also sits on the TBIU board of the Foundation for Innovation and Technology Transfer at IIT Delhi. I now hand over the session for deep dive to Dr. Sachin. Dr. Sachin.
Thank you very much for that very kind and wonderful introduction. I'm sure I don't deserve a word of that was said, but I'll take it anyways. It's good to hear all those things. Thank you very much for having me on this panel, and truly a wonderful panel, truly good to see old friends and new, and wonderful to see humans that have wonderful hearts, because we see people who've been volunteering with the largest tech platform on healthcare in the world now, uh, and providing succor to so many COVID patients uh, through telemedicine and telehealth, which I don't think was possible last year. So, just to give you a brief introduction of the organization that we've been volunteering with, Project Step One, it was started as a small WhatsApp group in March 2020 when the COVID pandemic was just about hitting us. And at that time, actually, telemedicine was completely illegal in India. There were no rules that allowed us to do telemedicine. But even then, some brave hearts, most of them techies, took this challenge of providing the best possible care to patients who they knew would be hit very hard with the oncoming pandemic through telemedicine. And it has grown into something immense and of a scale that none of us would think that would ever be possible, with more than 7,000 doctors volunteering on the platform and more than 3,000 other volunteers, including techies, paramedics, nursing students, nurses, and medical students as well. And it has grown into a behemoth, I think, much bigger in scale to anything else that we've seen in telemedicine, maybe compared only to a smaller extent by the e-Sanjeevani OPD that the government launched in August of 2020. So in March, when Project Step One started, as I said, telemedicine was illegal for a few days till the government finally brought out its telemedicine guidelines in March 2020. And in April 2020, of course, the e-Sanjeevani OPD was launched. I think it's recently hit a million teleconsult mark. And in August 2020, of course, the National Digital Health Mission was launched with a budget of about $60 million, which is quite peanuts compared to the situation that we are seeing. But it has a wide scope and a wide, I think, ambition to have health IDs, personal health records, digital doctors, facility registries, availability of beds real time, everything that should be there on your tips, I think, will be there hopefully when it's finally done. So, really privileged to have this panel to discuss the recent past and the near and distant future of telemedicine and telehealth. Uh, I would request all of you to please give a short introduction about yourself, and then we'll start deep diving into the various facets that you represent from Sanjeev from HR, Shashank from digital health, and of course, Krishnan from the operations side. But Dr. Sanjeev, can we start off with you? And if you could give a small introduction about yourself and what you do, and a little bit of your thoughts, and then we can maybe start the discussions. Thank you.
Sure, sure. Thank you, Suchin. Very difficult to measure up to your count of accomplishments and awards. I'm also a healthcare professional. Let me rephrase that. I used to be a healthcare professional, trained in physical medicine and rehab, transitioned out of healthcare into the world of technology, did my master's in computer sciences with recognizing that technology plays a very, very significant role in effective delivery of healthcare. Data is at the center of a lot of decision making in healthcare, and having that access of data, I found as a clinician, was challenging for me. And so that's how I kind of expanded my career, and I decided that I was going to take my career into the world of technology. After that, I was involved hardcore in the world of technology with a focus on very specific focus on patient safety and quality, developing software, deploying software across more than 200 hospitals all over the US. And then basically decided to come back to India after being abroad for about 30 years. And since I've come back, I've been extremely interested and have been dabbling a lot in public health, trying to look at what kind of models are there, how primary care works, what are the challenges associated with it, and so on and so forth. And it just so happened that I also became part of this WhatsApp group that Dr. Sachin referred to earlier on. And using a cliche, which I'm sure others over here will also use possibly, and like that, they say the rest is history. My role at Step One is very unique, and it's a wonderful platform for me. Because I get a chance to leverage my healthcare background, I get to leverage my technology background, and my third career, which is in HR. I'm now trying to specialize and do that as well. So it's a great opportunity for me to contribute to the organization, and it really has been an extremely enriching experience to be part of this journey, which is it's quite unfathomable to think that a bunch of us have come together and we've served practically 20% of India's COVID infected population. And I think that that's a huge accomplishment for an organization that's not even 1 year old. So having said that, I'll share more of my thoughts in terms of telemedicine later. Back to you, Sachin.
Thank you very much, Sanjeev, for this wonderful introduction about yourself. Really privileged to have you on this panel. Very difficult to find doctors and techies mixed together into one. So it's great to have you. Thank you very much for sparing your precious time and coming in. Shashank, you have a unique perspective of working in digital health across various platforms and various geographies, and now leading a big organization into its healthcare foray into the interiors of Bharat, as we call it, which has recently been focused on India. Would love to hear a little bit about you and your perspectives before we start the deep dive.
Thank you, Dr. Suchin. And honestly, now meeting in everyone in person, I think I'm the most youngest one and the less experienced out here in the panel. And I'm pretty nervous about it. And I have all the big leaders and big names in front of my eyes. So, I have pretty diverse experience throughout my career for the last 14 years, working with pretty diverse industries, starting from my career from banking and now in healthcare. And I think it's been 6-7 years with healthcare, and I'm totally in love with this particular industry. Uh, I've seen pretty much diverse sides of on the business sides of healthcare. Selling out to doctors and selling out to hospitals, and now being a part of an organization who's trying to disrupt and provide affordable healthcare in the rural part of our Bharat, as Dr. Suchin said, or in India. So it's been a challenging journey so far, and there are a lot of emotions when we talk about healthcare, especially about me. It's not about creating a business out of it. It's also providing the core birthright of each individual, at least to get an access to a primary healthcare. I think that's the vision that I hold, and that will be one benchmark when I will call myself successful, when I'll be able to connect all the population somehow, if possible, with at least getting basic access to a primary healthcare. So that's my vision towards healthcare. Also volunteering with Step One. I think it's more of a privilege and proud to be associated with this Step One, who's being one of the largest healthcare service provider, and especially raising out in the difficult times when people were crushing and rushing and were clueless what to do and what not to do. I think salute to all the volunteers and technology that we could provide and help the government and citizens to scale and fight COVID-19 towards it.
Thank you very much, Shashank. Thank you, and best wishes to you. I hope next year when we are chatting, you are the senior most amongst us in terms of your experience in healthcare.
Thank you,
See,
sir.
digital is all about the young and the disruptors in the society, and I don't think it has enough space for dinosaurs like us. But we'll try and keep working hard to try to fight it out with you, and keep trying to maintain our own space like we've been doing in the last few years. But I'm sure you'll be the senior most amongst us very soon. We also have with us Krishnan, who's a wonderful person at heart, one of the kindest persons I've ever talked to. Krishnan would be very happy if you could share a few words about yourselves and your perspective.
Sure, Sachin, thank you. Thanks for having me on the panel, and good to see Shashank and Sanjeev as well. A little bit of background about myself. I'm a engineer by education. I have a PhD in civil and transportation engineering. But much of my professional career, though post-engineering, has been in consulting, strategy consulting. I started with McKinsey and Company in the US. and then returned back to India and set up my own practice, focusing both in India and in the Middle East. I've also spent a lot of time with startups in India, worked with a cloud telephony company, the very technology that's powering telemedicine today. So I was the chief operating officer of a company called Nularity. And now I am a co-founder of a company in the sustainability and environmental impact space. So, but in step one, I've been associated with for several months now. I focus on operations. I focus on the delivery aspects of telemedicine and healthcare, and it's exciting. I think we have proven this model can work. I think, and we have proven that we can actually make an impact on people's lives, save lives using telemedicine in a scalable format. So I really look forward to speaking more about that and how India can move to this next version of healthcare and can truly be healthcare for all, because you no longer need to access a hospital or expensive physical facility. All you need is a mobile phone and you can get treated. So I think that's a incredibly exciting position to be in. So yeah, I can't wait to get started with this discussion.
Thank you very much, Krishnan. And I think we should start with what you mentioned, the scalability issue and shrinking of the world. We work a lot in semi-urban and rural areas, and the aspirational point of view of the community there is right up there with anybody else in the world. Because see, digital has shrunk the world massively. I mean, earlier there was a big difference between what you could do in New York or what you could do in Paris versus what you could do in Delhi versus what you could do in Panipat. But now with digital coming in, everybody is exposed to what is happening around the world, and that has raised the aspirations by a massive amount. The only problem I see is that medicine is a very personal, niche kind of an area where you need a doctor speaking to you one to one. Unlike a singer or an actor who can satisfy millions of people at a time, right? Shah Rukh Khan can be sitting in Mumbai producing a video, and millions of people would be very happy to see it, consume it, and pay money out of it. I don't see a doctor doing that very soon. So how is it scalable? How can we reach millions of people when we only produce 67 endocrinologists every year and we are the diabetes capital of the world? So where do you see from an operational point of view, and then maybe we can quickly go over to Sanjeev and Shashank for their points of view, because I think they are very precious as well, on how do you address this scalability problem? Is two-way telemedicine at all possible to the same scale like entertainment industry is doing right now?
Look, I think, I mean, I don't know if I can draw a parallel to the entertainment industry, but I certainly believe huge potential for scale in the personalized one-on-one telehealth industry. I think if you look at kind of some of the elements of, let's say telehealth, or the remote elements at least, you can build a technology platform as we have built in Project Step One, which can facilitate large number of one-on-one interactions, simultaneous one-on-one interactions of doctors and patients. So you essentially are eliminating the time it takes to travel to a hospital, time it takes to sit in a waiting room, and so on, and having highly efficient interactions between patient and doctors with an extremely effective use of time. So I think the platform, the technology platform that you build is going to be incredibly key. And of course, there are really challenges around low bandwidth parts of the country versus high bandwidth parts of the country, especially when it comes to video consultations. But I think that's a problem that's probably more likely going to get solved sooner rather than later. So I suspect that a platform right now, it's voice based and SMS and other means, can very easily transition to a video based consultation model fairly quickly. And you surround that with, suddenly then a doctor in Panipat will have access to the best endocrinologist sitting in a Delhi or a Mumbai, and doesn't have to necessarily rely on someone who probably doesn't have the specialization or the skill set in the local hospital. So I think you actually increasing the reach of healthcare. You're truly democratizing healthcare. I mean, I can't, I think, we say I can go on about the benefits, I think, of what really this does, for, like you say, to fulfill the health aspirations of people in Bharat, for that matter. So.
Right, brilliant. I wouldn't have really believed you last year if you had said this to me, that you could build a platform that could enable millions of one-to-one transactions, but you just did that. So now I believe you. And it's amazing how it has been built. And Sanjeev, coming to you, see, building this platform is something that technology can achieve, has achieved already. We've seen that. But staffing it right, getting the doctors right, getting their incentives right, moving from a purely voluntary model that you do right now because it's a pandemic, it's a disaster, people are ready to do it, but are they ready to do it for their whole lives, right? How do you staff it? What are the HR challenges that you see in this platform that will cater to millions of one-to-one transactions?
Okay, okay. So what I was saying was that there's several efficiencies that I mean, so kind of going back to this entire pandemic, when we think about this crisis that has happened, right? But to quote an old cliche in Hindi, "Jo kuch hota hai, bhale ke liye hota hai." So maybe this pandemic is kind of what we needed to really realize what a technology platform can do, right? So in addition to being able to reach people because of access to a mobile phone and access to all of that, that's definitely an aspect. But I think what we've also discovered is the doctor is not required for every healthcare intervention. There are intermediaries in between. There are like the ASHA worker that's there on the ground in several states as well. And we've discovered the same thing as well, that in terms of, given the fact that doctors are limited, what is the most efficient way to utilize the doctor, and what are the gaps that can be addressed by people who are non-medical professionals. So that's been one very, very valuable lesson that we've learned from that. And coming to the question that you asked me, Sachin, I don't know whether I have a conclusive answer, but it certainly feels that I have never seen an outpouring of people coming together so quickly, so rapidly, with so much passion to be able to contribute to ending this pandemic, right? So it's almost like, again, this pandemic has triggered empathy in people. This pandemic has triggered patriotism in people. This pandemic has brought about so much of different types of awakening in different people. And while I see that, while the cases have been decreasing, there has been a little bit of a lull. But on the counter side, on the flip side, I'm still seeing volunteers saying that we want to come forward. We still want to contribute towards what you're doing. We want to know where you're going next beyond COVID, right? So how this is going to unfold in terms of whether we will be able to sustain it purely with volunteers has been done, I suspect that's going to be doubtful, right? Because at the start of the pandemic, people were locked down and people had an abundance of time and people were not traveling, their work responsibilities were lower. As life returns to normal, I think people's time will be limited, but I also think that there is going to be a new normal. And that new normal involves what I believe has started, not, it's the other CSR, citizen social responsibility, where citizens start to feel a sense of being committed towards the nation and helping their fellow citizens and stepping forward, whether it be in healthcare or whether it be in different areas. I think that this is a trend that we're going to continue to see over a period of time.
Thank you very much, Sanjeev. Love your mnemonics every time. Every time you bring up a new one, and it's always brilliant. So, love this new CSR. But as you said, doctors are not required for each and every healthcare intervention. And I also truly agree with you. Shashank, from that point, do you think telemedicine is actually an effective solution at all? And is it right for every healthcare business, or are there some things that you can think differently of?
Sir, as everyone said, I think telehealth, will continue to play a major role in a hybrid model of care that emphasizes treating patient where and how they prefer, at home, on the go, or in person. Right. With this shift, the industry will reduce cost, waste, fewer resources, increase access to care, and improve patient outcomes. Right. Uh, when we go to the rural side of India, we understand there are a lot of gaps in terms of getting access to healthcare. The traveling is a problem, and all these issues that we see, right, and that have already highlighted with with this pandemic that people and the entire population of the globe face. I think telehealth will not be the only solution that will have a dependency on, but it will be the a medium or a mode to get in initial contacts with the patient. As we say, it will be a great way to facilitate initial contact with the patient. They cannot substitute for the chain core of business. You yourself, the doctor Sanjeev, is a doctor, right? The in-person examinations and surgeries cannot be replaced with technology. That has to be done. And we in India, until unless we are not get this in-person touch, we don't feel that we are cured or being taken care of. So the entire healthcare platform will see a surge in the business, or it will be a support system to the healthcare to have a major penetration to get the healthcare delivered to the population.
Thank you very much, Shashank. So, what I hear from you and Krishnan is you say that there is this medical issue that physical examination is not possible. So, there are some limitations. Krishnan said that there is a non medical issue which he hopes will be solved very soon of network issues and network availability. I also see many other medical and non-medical issues that you can think of. So in medical issues, there would be definitely miscommunication of symptoms by the patient, which even happens in physical consult, where you have the liberty of clarifying a lot of things compared to a teleconsult. There will be definitely misinterpretation of signs by the doctor. You can't really see the same yellow in an icterus jaundice patient physically that you will miss maybe in a teleconsult sitting like this, because the colors are so different. I can see that my red colored is looking like more like black hair on my screen. So that definitely you won't be able to appreciate the anemia. So you will miss a lot of signs while seeing it on a screen rather than physically. So there will be misdiagnosis, and of course, as you said, physical examination will be the one thing that we will miss the most. Non-medical issues, of course, that there will be network issues, hopefully, Krishnan, things that they will be solved very quickly. But then there will be the app usage issues. You're not really familiar with the tech, maybe. And the most important that we think of is the breach of privacy and the cyber threat. People will hack everything around you. So, Krishnan, from an operational side, do you think you can really solve these issues? Or do you think they're not important enough and you can bypass them, because the 80-20 rule that you can still solve 80% of the issues without really. And non-medical people will anyway tell me that doctor doesn't touch us anyways, no, he just sees us from screen and sends us away. So what do you think is there? Will you be able to solve it, or is it not worth putting the effort into right now?
Look, I think the issues as articulated by you, Dr. Sushin, are real and cannot be ignored. I think right off the bat, I will say that it's important to acknowledge and realize they exist. But I think even in the best of scenarios, when we talk about telehealth, it's truly a hybrid model. You cannot go 100% telehealth in any case. There are a range of interventions that require physical infrastructure. From it could be diagnostics, right? Or like you say, some of the touch and feel examinations, tests, surgeries, and so on, hospitalization, and so on. So I think so. I would say that telehealth is essentially given an opportunity to push the boundaries way beyond what was happening before. A lot of the things were not digitized before, including patient health records, right? I mean, literally, but by the virtue of running a telehealth platform, you're digitizing a whole bunch of things around the interactions. Data is getting digitized. Prescriptions can be digitized. So there are multiple benefits of a telehealth platform on a variety of fronts, right? I think in terms of access to specialists, even for a consultation, right, in a faraway location. So I think the scope and breadth of what a telehealth platform can do today to healthcare in India is probably orders of magnitude greater than what is happening today, right? I mean, I think if the penetration of telehealth today is so low, pandemic has changed that. It's warmed people up to the concept of getting a consultation on the phone. That certainly has happened in my family. I can see that because we don't want to enter the hospital right now for various reasons, right? We're just not so sure. But at the same time, if there is something that requires an actual in-person visit, and there will be situations, I think we got to do that. So the short answer is, I think the questions around technology, connectivity, right, their ability or their improving the understanding of how someone in a rural area will use an app through education to do that. All of that will have to happen, and can happen and solve that problem. And I think that will be the kind of best case outcome in any case. You still have to acknowledge and realize that there is a space for the physical infrastructure that is absolutely essential. And kind of, I think this hybrid model, whoever gets it right, I think can make a huge difference. I think in step one, we work with the physical infrastructure of government hospitals. But if you think of telehealth in the private space, I think there's going to be a lot of innovation and new thinking necessary on how they're going to bridge the telehealth offering with the physical infrastructure. So yeah, I can see some interesting economics in play there, and how to make it work. So.
I'd like to kind of add to that. I think if you ask anybody what is medicine, they'll tell you it's a science, right? But anybody who's experienced receiving healthcare knows that it's a combination of science and an art, right? The art cannot be digitized. The touch component cannot be digitized. The empathy component of it cannot be digitized. There is absolutely no substitute for digitization of that. But there is much to be said for the science of it in terms of being able to accrue large sets of data, being able to apply algorithms of data to determine whether you're providing the most effective care, whether you're prescribing medications that are going to interact with each other. These kind of things, technology plays a very, very valuable role. And let's not forget that the entire world of sensors, I mean, smart watches and stuff right now are doing some very basic primitive things. But if you look at the practice of cardiology in some large institutions, the ambulance, while transferring a patient who's had a suspect heart attack, has already passed on the ECG information to the hospital through sensors, through this digital mechanism, by means of which when the patient gets to the hospital, there's this golden hour and the person is ready to have the angiography and the angioplasty if required, right? Years ago, this was not possible, right? But this is changing in so many different ways. And I think that in India in particular, with the indigenous development of sensors being so low cost, there's a ton of data that we'll be able to collect proactively rather than waiting for the person to get sick. And when you accrue a large data set of an individual or of a population, there's a whole bunch of predictive analytics that can be applied on it to promote the overall health of the population, right? So I think that beyond the telephony and the video consultation, there's a whole bunch that we at Step One are also have started to think about, but some of this stuff is out there and is being used in some advanced places. And there's so much monitoring that can be done remotely. And I think in this pandemic, I must have seen at least 50 startups that are doing remote monitoring and developing business models that are getting them going.
Brilliant. Love the analogy about the science and the art, and how we should just focus on the science first, like the 80-20 rule. We'll worry about the art of it when we come to it. But Shashank, you work more in semi-urban and rural populations, and I think this challenge is much bigger for you, right? From bandwidth availability to tech friendliness to behavior change. But still, you see that the organization that you're working for has seen a massive spike in teleconsults during the epidemic, coming down now. So where do you see your challenges being solved from? Or do you think, like I asked Krishnan, are these worth solving at all, or should you just focus on the things that are low hanging fruits and just leave the rest for people to come forward with?
No, Villa, we cannot avoid them. I think, if from my perception and my limited knowledge, that I hold, I see the three critical barriers, right, that we see in terms of entire the expectation from the digital health or the telehealth, right? The first is the regulation and data sharing, right? The health sector is, and everyone comes from a background of the industry understands that the health sector is very rigid, owing to its responsibility to ensure the safety, privacy of both patients and healthcare providers, right? Unfortunately, this very rigidity can endanger the people it wants to protect. Regulators should work with the government to update laws, especially the ones concerning information protection to reduce the compliance cost, right? The second thing that I see is integrating technology into clinical practice, right? In most of the countries, healthcare facilities have been slow in adopting telemedical solutions, right? And thanks to their low IT budget or outdated legacy systems that we see, or lack of skilled human resources or interest or acceptance towards the technology. This has led to an environment where telemedicine is run by startups, right? As Sanjeev just said, that we have seen around 50, 60 startups coming up in this space, and overall numbers is 355 startups playing around in this M-health and e-health in India, right? So who have faced significant changes, right? And as you also said, Dr. Suchin, that in the beginning that it was a crime to do a telemedicine, before, as we say, BC and AC, right? Before Corona and after Corona now. So I think hospitals should, us, especially like the industry where I am in and the organization I work with, I think should issue executive directives to mobilize healthcare professionals to use cloud-based technologies by equipping them with necessary electronic equipment, right, and training to launch and popularize the services. And the third thing, which is pretty important, is the technological inertia. And to scale up telemedicine, providers should be able to streamline and simplify the patient experience. Instead of all patients crowding up out in the OPD of the hospital, some of them can receive the services from, as Sanjeev said, the e-diagnosis, e-testing, e-prescription, and remote health monitoring. We have seen a lot of advancement in terms of technology of ECG, pocket-sized ECG machines, or some IoT devices, which can capture real-time data and can deliver real-time reports also, right? And also the capability of high-speed internet, which are available with 3G, 4G, or going forward for MG, I think 5G, right? So cloud-based platforms do not need installation of expensive hardware or additional software development. I think there are a lot of small, magnificent startups who are building great amount of products in terms of scaling the telemedicine. Once these issues are sorted out, I think figuring out how to encourage patients to avail treatment from their homes will be very critical, because the acceptance have increased, right? Post this pandemic that we see, the ecosystem, the stakeholders, doctors, government, consumer have accepted technology in healthcare, right? As you said, Shah Rukh Khan could have posted a video and it could have been viral, and that's content, and we all love to go through it, right? All that YouTube, Instagram, TikTok, or Facebook. I think we invest our time, data, and technology in that. But when it comes to healthcare, people becomes, it's a need based. So how do we change that perception and make it more acceptance to the local population? I think that will be very critical going forward once we have all these three barriers, getting rid of all these three points that I mentioned.
If I can just add one thing to that, sorry. I think while we have talked a lot about the science and the logical side of this problem, I do believe that the doctor community have a lot of leverage in changing the level of adoption of telehealth. I mean, if I have a doctor on a call or on a video call assuring me that this is a sufficient and safe interaction and is and can advise the next course of action based on that interaction, I feel a lot more comfortable than if the doctor were to say, no, it's better I see you in person. I think so. I think the role of the doctor community specifically, and how they adopt and encourage telehealth, I think will go a long way in actually this becoming playing a greater role. So I thought I'd leave it there for Dr. Shichan and Sanjeev to react.
So yeah, so there's, I think that there's been a tipping point really. So I remember meeting a liver transplant surgeon who's a very, very dear friend of mine. And I met him for dinner one day after several years because surgeons are always busy and never available and on call and so on and so forth. And it was such an annoying dinner because he kept getting calls throughout the evening that we were there. And finally, then he turned his phone off and he was like, what to do here? I mean, this is the nature of my practice. Now, these telephone calls become monetizable. That becomes a tipping point for the doctor, which doctors have discovered now when everybody's practice is kind of shut down and they weren't able to have their physical infrastructures, that they can monetize doing remote consultation. That's one thing which I think is very important, is for the doctor themselves to understand that they can monetize so it's kind of, Shashank, what you said was like, why should I go get a pizza when I can get a pizza delivered at home, right? So I'm saying patients are going to have that experience, but doctors are also going to say, I don't need to go sit in my office when I can sit on my couch and talk to somebody and provide a consultation, right? And I think that there's one very, very important aspect in healthcare, which is the overall awareness of the population. That is huge, in which technology can play a massive role. We've already seen that. I don't know one person in India that I have met who does not know about corona, simply because of these pre-recorded annoying messages when you call anybody's telephone number. So if there is a mechanism by means of which, can you imagine educating the Indian population about diabetes or about heart disease or about infections or about immunization, about something else? So we haven't really unleashed technology. Right now, we have reacted to the crisis because that was a need of the hour. So we've utilized technology to curb the pandemic. But have we really leveraged the available technologies that are there? So I'm not even talking of new research. I'm not even talking about AI. I'm talking of fairly primitive things that can be utilized to result in a generally a healthier population.
It's a brilliant, I think, line of thought that Krishnan you have unleashed. So we've always been talking about how the community's behavior has changed, how the community is now incentivized for telemedicine, how they don't need to get their car out and find parking and spend a whole day. But this is exactly, I think, what's missing in the conversation. And this is why primary healthcare has never been successful anywhere. Because see, especially in a pay-per-use model like is there in India or the US, where it's sick care more than healthcare, right? Because the incentive of the doctor is you fall sick, you come to me, I'll put in a stent inside your heart and I'll earn the money. Whereas the patient's incentive is I should not have that heart attack at all. But the doctor is not being incentivized enough to make sure that the patient is not having the heart attack, because he doesn't have time to educate the patient. He's always busy in either operating or having dinner with Sanjeev. So we are really busy professionals, right? So I think we need to really discuss how is the doctor going to be incentivized for this telemedicine model. Because if he's not incentivized enough, it will not be a success. He would rather say, I don't want to waste my time, on this call. I would rather just sit in my clinic. You keep coming to me, I keep seeing you. Why would I take this call? There is one incentive that Sanjeev has mentioned, that the call may be monetizable. But is that monetization enough for the doctor, that he just monetizes a part of his consultation fee? Because the doctor has many other incentives, right? If the patient comes to him, it's the consultation fee, then the laboratory, and then the pharmacy, and then maybe the patient gets admitted to his hospital. There's a whole gamut of services that the doctor offers. So is this call monetization enough, or do we need other incentives for the doctor community to adopt teleconsultation and telemedicine wholeheartedly, rather than being a minor irritant, which I think they're feeling it right now?
Sure. I mean, I can go first on that. I think in the in the BC world, right, or the before Corona world, the tele part of the consultation was always considered as an add-on. I've come seen you in the hospital once, right? and maybe there is a fee paid for consultation, and then I keep sending you messages, WhatsApp calls, right? All of that, and kind of there's this expectation that all of that is just a complementary interaction. But I think uh, that probably there's been a little bit of a change. I wouldn't say as much of a shift, but I think there's definitely a shift away from that. I think given that even the initial interaction is now happening on the telephone or a video for that matter. So I think there is definitely a possibility to increase the level of monetization of these interactions, and you can put protocols in place. It's not that hard. Doctors again don't necessarily have to share their personal mobile numbers. There are other ways the platforms enable where the interactions can still be managed by the administrative layer, and kind of control the set of interactions. So I actually think much of what's happening in the hospital today can just essentially smoothly move to a telehealth platform, be it prescriptions, because doctors still be writing prescriptions on his or her name and issuing them, recommending tests, right? Again, for which a prescription be needed. Now, the physical infrastructure where they go for tests, yes, I think there's a little bit of democratization happening there, because then the person is going to whatever's most convenient. But I think the models will emerge. I feel these are all opportunities then for that hospital to offer an attractive enough level of service that someone will both come to their doctor as well as use their labs, as well as use some of the other facilities they offer. So I think it will require potentially some of these healthcare facilities to increase their level of service and quality of service. But that's a good thing. Then I believe patients will benefit, and so will the hospital. So I actually see again opportunity in this happening.
Shashank, what are your thoughts on it? How do you encompass all of this teleconsultation, medicine delivery, laboratory testing, and entire digital experience to make sure that the patient has a sticky experience with you, rather than exploring other avenues, because he's free to do that now. So once he comes to your platform, how do you ensure that the patient has a sticky experience?
Look, we have a habit, when it comes to our head only, then we learn, and that's what pandemic have taught us, and that's how we accepted the technology. And the first question that in terms of you raised the doctors monetization and the incentives, right? And I'll just add few lines into that. I have a pretty different perception towards that. Doctors will 100% accept the technology or will prefer using teleconsultation as their in terms of their service going forward. I think telehealth or the technology will definitely reduce their ARPU, as we say there is no business side, the average revenue that they can earn from a patient, right? Because the patient might go and buy medicine from some other pharma or medicine retail shop, or will get say diagnostics from the nearby houses, whereas the doctors have a partnership with the nearby things. I think telehealth will become a need, right, for doctors when they require it. That's it, right? And for the patient, I think as a lot of startups and the healthcare or health tech companies are working, I think it's more convenient for the consumer to discover, right, and go to the patient, navigate the entire patient journey, where we say again, and how does the discovery, as we say, the practice has solved the problem of discovery. Whenever we go to a new city, we can find out easily which doctor, which hospital to go in, all the review mechanism and the doctor listing, right? For the consumer point of view, I think telehealth or the entire technology is good, right? I think it empowers the patient to interact with multiple doctors whenever they need. If I think recently the second opinion, which is floating around the market, the technology, we say, okay, yes, there's a pool of panel of doctors. You submit your reports, and the report sharing is being taken care of, and that they can come and give you some solutions out of it. I think all this it basically helps the patient to get connected and get access to the healthcare is very fast mode. Whereas in the past, he or she used to depend on the local chemist or the in-house GP in his location, and then keep on worrying, or have to travel to the tier 1 cities to go for an better consultation which was pretty heavy cost. Now with the help of technology and multiple players around, I think it's pretty convenient for a consumer to discover and get a better treatment with a click of his button. Still, as we understand the challenges or the nuances of the acceptance by the medical fraternity, how they welcome this technology in their daily practice, while someone will they prefer, I have seen in my daily routine that doctors still want patient ki ghar clinic bhej do, right, rather than doing a teleconsultation, because somehow uh, it doesn't help them to increase their daily earning. It reduces that, it gives you a dent, right? And also the consumer becomes so smart that he starts doing a lot of window shopping in terms of doctors, kaun sa acha hai, kaun sa bura hai, main jaun nahi jaun. I think these are all the other challenges. And but obviously, as we have seen, growing, the technology has solved a lot of problems. But I think it should be welcomed by each and every stakeholder in the ecosystem of healthcare. And I think then we can see the scalability of particular telemedicine or telehealth or mHealth going forward in the near future.
One thing I think, Suchin, I think that we may be a little bit far away in terms of the incentivization from a preventative perspective, just because our healthcare infrastructure, particularly the insurance industry. So if you've seen the trends that happen in countries where medicine is socialized, doctors are paid based on outcomes. So the superior your outcomes, the higher the compensation. Now that shift has already happened in the private industry, in the private insurance sector in the US as well. But our insurance sector is relatively nascent in terms of making those kind of payments, right? But I think it's a matter of time before, at the end of the day, the consumer wins, right? So at this point in time, it's the consumer stickiness will result from effectiveness of care, essentially from satisfaction, right? But I think as regulations start to kind of enter and standardization starts to enter, and people start to look at, who are the people who are performing, who are providing higher quality of care, I think those kind of structures in terms of compensation also will emerge, as has happened in other parts of the world already.
Yeah, I think that's perfectly said. But coming back to that train of thought, from an HR point of view, Sanjeev, how do you make this sticky enough for your doctors? I mean, one is that you said we are far from maybe incentivizing them from an outcome model or socializing medicine, as you said. But right now, you are running one of the largest telemedicine, telehealth platform in the world. You have so many doctors working for you. How do you make sure that you have these doctors or more doctors joining you in the years to come, not just the months, and make this into a sustainable model? So what are the incentives that you've thought of to make this sticky enough for your doctors rather than just the patients?
So, Krishna, please jump in over here as well. But I'll tell you some thoughts we've had, right? When we've been having these conversations in terms of how do we do it, right? I go back to what I believe is citizen social responsibility, right? I'm finding that the medical fraternity is now engaged in taking care and remembering that Hippocratic oath that they took when they graduated, saying that I will serve people that require me, irrespective of whether they can compensate me or not, right? I've seen a significant jump in this, and Suchin and Krishna, and you jump in as well from perspective that, what your experiences with the doctors that at step one that have been there, right? But in addition to that, we are thinking at the end of the day, professionals are in their professions. One of the reasons that they're in that profession is to be able to earn money. So how do we make it sustainable, right? So we've been thinking of models by means of which, we would be providing the platform by means of which new doctors who are starting their practice would get a ready-made practice out of it. And in return for giving you these patients that you provide consultations, you agree to do some philanthropic work. So I don't know, just a random example would be, we give you a patient by means of which you earn 100 rupees. Now for that 100 rupees, please serve 5 people that are not able to afford to be able to pay for that. Right? So I think we're in the talks of we're in the midst of discussions about these things, but these are very valuable things that need to be thought through and figured out. And I feel pretty confident that models will emerge. The disruption is going to happen. Specifically, I don't know how, but I feel very confident that it is going to happen. Over to you, Krishnan, to kind of pitch in your thoughts with respect to your observations and experiences.
Yeah, absolutely. So I think so. When we're talking about Project Step One and this, and it's Project Step One's ability to attract medical professionals and doctors. Look, I think doctors volunteering their time for a cause in many ways has always been happening. It was not that COVID wasn't the first time they've been volunteering their time. A lot of doctors, experienced doctors, give a few hours or a day, a week in some kind of social setting, either providing, free healthcare or reduced healthcare and so on. So I think Project Step One essentially offered one more avenue for them to offer that philanthropic time that they were otherwise offering in other platforms. So I think I don't necessarily see a challenge to that. I think that will continue, and I expect doctors to continue to be present on our platform, offering their time and services. And as our platform expands as well beyond COVID to offer some of these other supports in collaboration with governments around, let's say, tuberculosis or maternal health and so on, there are opportunities for doctors to get paid consultations as well. So I think, so there is a certain level of stickiness to the platform where it will be a platform where they can get some paid consultations and also be a place where they offer their time and support for the COVID cause and so on. So I think I don't personally see a huge challenge on that front as it pertains to step one.
So Shashank, I think it's more of a challenge for you. So at Ujala Cygnus, you work with the communities that are rural and with hospitals that have just maybe one doctor per specialty. Those doctors are really stretched for time. How do you incentivize those doctors to adopt telemedicine? Because it will be very tough for you, I'm sure, if you have a cardiologist, one cardiologist working in a 150 bed hospital with patients and cath procedures and emergency angioplasties at night, and then you tell him to attend 5 telemedicine calls as well. I'm sure it'll be difficult to convince them. So how do you incentivize your doctors to adopt telemedicine?
So, I'm being very honest on that. I think it's really tough when we ask for a super specialty doctor that that you have to devote some time in teleconsultations or doing some consultation via mode of technology on the online side. The ideal situation that we can be implemented where we utilize their efficiency and their expertise of the super specialty doctors is give them those cases where actually the intervention is required. I think now here we can empower the general physicians, right? The quantum of GPs that we produce in an year is way high as compared to the super specialty doctors. So if we can just use the same system that US or Europe uses, that the first interaction with the patient should be with a GP, and then he or she should be guided, the particular building up that entire triage for a super specialty doctors. I think that really motivates the super specialty doctors, right? Because not every doctor is here for business. There are a lot of who are there for services also. Not everyone seeks money out of it. In last 7 years of working for healthcare industry, I have seen a lot of doctors who says I'm happy to do for free even, right? But their time is very valuable. If you respect their time, you really respect their their education and their expertise. I think many doctors will come up who is okay, yes, fine, I'll do a teleconsult provided the patient first instruction has been done with a GP. There's a case handed over to a super specialty doctor that this is the particular case, this is the consultant that the history has been shared by the GP to the super specialty. I think they'll be pretty much motivated towards doing that, right? Not everything, we cannot just follow the same carrot and stick theory with doctors here. It can be replicated with a sales or some operations guy or some different domain, but not with the doctors, right? You have to respect their education at the end, right? If you just tell doctors, we'll use you for an expert opinion, I think they'll feel more privileged doing that, right? Because the moment we say a teleconsultation with a super specialty doctor like a cardio or an ortho, right, is free, you will be getting bombarded, especially in rural set of market, because people will say, okay, नो या मैं बात करता हूँ, फोन लगाओ, इससे वीडियो कंसल्टेशन में मजा आएगा. People start, encashing that, and that really affects and demotivates a particular doctor. I think let's build up a triage where a filtration process where a GP intervenes and then goes to a super specialty. I think that can be a decent process to implement and scale.
Right. I think there's a very interesting thought. So, yeah, Sanjeev asked for my experience in step one. So, I really feel that my faith in humanity has been restored over the last 1 year, seeing the massive number of doctors and volunteers just coming in, and they have no concern. I mean, money is the least of their things. I think they don't even have a concern whether their names are coming up anywhere, whether they are being recognized, whether anyone even says thank you to them. I mean, they're calling people and people are screaming at them and blaming them for the government's issues, that cleanliness is not there and my colony has so many mosquitoes, and the doctor is listening to it patiently and then telling him, okay, don't worry, I'll help you out as much as I can. And then they come and vent it out on the WhatsApp group that we are in, of course, but it's so good to see them. So what I feel, Sanjeev, what you said, the 100 rupee paid and 5 free consultations, I am a bit skeptical about that. I don't think quid pro quo works in philanthropy at all. We've seen that in Delhi a lot, where the government said, okay, we'll give you a free land for the hospital and do 20% of patients free. And we know how that goes. So I don't think quid pro quo works there. I mean, you need to recognize, as Shashank said, what are the incentives that the doctor is looking at. Not every doctor is here for money. I mean, I think that number is the least possible you can think of, because they come up, because the bad fish always come up to the top of the pond. So you look at the fact that these are the people trying to make money, but I think many doctors have their main incentive in recognition, that the community should know me, I'm the biggest doctor around, this and that. So recognition is a very big incentive that you can provide to the doctors. Academics is a big incentive for people. It's not really a surprise why All India Institute of Medical Sciences, AIMS, has so many doctors lining up to get one job and then sticking till the time they retire, where easily with that kind of a credential and background you can come out of AIMS at any time and get a job worth crores of rupees in any private hospital. But they will still stay there because the academic environment and the academic reward they get is beyond what they'll ever get in a private hospital. So I think the recognition, we need to see what recognition this doctor wants. So there'll be a few who will need this, that okay, I need 100 rupees and then I'll maybe see other your free patients. I don't think those are the right hires for a platform like that. I think you need to weed them out the first thing, that and then maybe look at the other ones who will be there, that okay, I want to serve the community, I want to access so much data. If I see 1,000 patients, I'll build up a database that I can work on, or something like that. So yeah, but plenty of models to work on. I'm sure the models will come in. But then of course everything boils down to how the government sees you, right? And if they shut your shop tomorrow and allow you, so the management guru Porter used to say that structure follows strategy, right? You build a strategy for yourself and then you structure the organization accordingly. But I always feel that strategy follows structure, because you are never born in an empty space. You're born in a space where there's always some kind of a structure already around you, and you have to build your strategy according to that. So, what do you think are the telemedicine rules going to be? How are they going to affect you? Will they switch very quickly as telemedicine evolves, or do you think that the guidelines that are now there will be stable enough for more platforms to come in? So, maybe we can start off with you, Krishnan. What do you think are the telemedicine rules and regulations that are going to be there? How do you see the future? And how do you think the startups that you see now, Shashank said 355, how do you think they are going to adapt to this and work their way around it?
I'll be honest, I'm not entirely familiar with the current regulatory infrastructure, but what I would say is where, I think recap some of the areas where some of the laws will have to be put in place so that both doctor and patient feel comfortable. I think it's going to be entirely around data security, information security, and also the interaction remaining private. I think the doctor-patient interaction why is one of the most private interactions, be it on audio or on video, and uh, nowhere in the world does doctor take consultations in a public space, right? There's like so preserving that sanctity of that interaction and making sure that that doesn't fall in the hands of anyone, I think is very important. And there's and broader facets around data security, I think is probably going to shape right, I think, or needs to be shaped. There's probably a fair bit around clinical protocols as well. I think we earlier in the conversation we were talking about the various shades of yellow and what happens and so on. So I think a little bit of the protocols will have to evolve to cope with this new technology, and how we handle. So I think there's probably a lot of work to be done in that space. Is from where I stand, it appears that there is a fair bit of legwork to be done in the overall framework if telemedicine were to become the norm in India. Right.
Right. What are your thoughts, Sanjeev, on the various
So
regulations?
I think there has to be emergence of standards. There has to be emergence of a framework, because now there's going to be health data that's going to be exchanged between different entities, different organizations, different providers. And if there is no standard of data, as has been discovered in several Western countries, that when you don't have a standard or protocol, the data from provider one going to provider two becomes absolutely meaningless, and second provider has to kind of start from scratch, right? So I think the progressive organizations are certainly going to think about their own standards in terms of being able to exchange data with other people. And the framework, I don't know sufficient about, I don't know enough about, what the regulatory bodies, what the government, how soon they're going to publish something. So I think it's a combination of a push that's going to be from the private sector that's going to say, hey, define your standard, or here's what we're coming up with. I've already seen some trends. Just a few days ago, I was part of a conversation where they were talking of using Loink as a standard to be able to order tests across different things, by means of which panels are standard, whether it goes to lab 1 or lab 2, right? And this has happened, all this has been precipitated in the pandemic. So I think that there's several schools of thought in terms of, if telemedicine is here to stay, what is the framework? What are the regulations? What are the must-haves for people who want to play this game? So I think it's going to happen. Time, no idea.
Brilliant. Shashank, your thoughts on the needs and the problems that you foresee?
As I said, I've mentioned the three barriers, and I think the most important one that we are discussing is the regulations and the policies towards, the shifts impact. I think it's time for the government leaders and stakeholders, the health tech leaders and the healthcare leaders, to reimagine the way healthcare is to be delivered to patients, right? We have seen a lot of countries, international countries, encouraging wider use of telemedicine services. Our own Prime Minister, Mr. Modi, mentioned that use telemedicine as as a gateway for the healthcare. I think even our government recognize the role of telemedicine can play to elevate the burden of our fragile healthcare system. I think before the pandemic, few insurance companies would reimburse for teleconsultations or home-based medical tests and diagnostics. And now even we could see a lot of surge where insurance companies want to partner with telemedicine companies, startups, or M-Health or L-Health to reduce their burden from the claims. Right, government also imposed regulatory restrictions, due to concerns about patient safety and privacy, as well as for the potential of fraud. I think those concerns are still valid, but as restrictions temporarily ease for the pandemic and the benefits of telemedicine are readily apparent, right? There are fresh calls for collaborations and policy reform. There were a lot of skeptics around telemedicine. Policymakers are seeing that telemedicine reduces the risk of while improving the efficiency, and it's perhaps the most appropriate medium to connect to the underserved and typically the rural side with the access of quality care. I believe the industry has significant opportunity to bring about that change. I think we all collectively, it includes the government and the healthcare leaders and the health tech, have to come together, reform the policies and regulations so that it's still accessible and convenient in terms of all those nuances that we have faced in data leakage, or because there's a lot of medical data that's been sharing here and there, and the security, the HIPAA compliance that we talk about, the guidelines that we keep on hearing, I think has to be reframed and reorganized so that we can take this technology way ahead and can be one of the part of our daily routine.
Wonderful. So Shashank spoke about the three barriers. Sanjeev, being a devil's advocate now, what do you think will be the barriers? And if we do an anti-mortem kind of an exercise, why do you and where do you see telemedicine dying a slow death like it died about 10 years ago? So
Gonna happen.
I remember 10, 20 years ago, I used to attend conferences. There always used to be a session on telemedicine, telehealth. It was shown as the next big thing. And then it slowly disappeared from all conference agendas and died completely till COVID brought it back to life. So where and how do you see it dying again? Being a devil's advocate, just think what will be the barriers that will kill it again.
Honestly, so I've witnessed the evolution of telemedicine for the past 25 years. And I remember there was a small startup in San Francisco that started doing chat-based consultations, right? And when they started doing those chat-based consultations, everybody was like so dismissive of them. Well, 2 years later, insurance companies started to pay for chats because they were more effective than in-office visits. They got acquired by a behemoth, McKesson, HBOC. So I'm finding it very difficult to be a devil's advocate for the disappearance of telehealth. I think it's here to stay. I don't think it's going to go anywhere. It's a combination of me as a consumer who likes the ease of access of being able to talk to you and saying, hey, boss, I have this problem. I want to discuss it with you. It's the provider who is able to now monetize services that were bundled under the umbrella of, I've seen you in a hospital, admitted you in a hospital, so you can send me infinite WhatsApp messages and do infinite chats. And I think that the regulatory framework in itself is going to shift as well. So unfortunately, I'm finding it very difficult to be the devil's advocate for this thing. And I hope I'm right about it too,
No, I think it's
Wonderful.
true.
We need more people like you to proselytize for telemedicine, Sanjeev. But Krishnan, think of it as a devil's advocate. Just kill it. How do you kill it?
Look, I think it's in the hands of the doctors. I think if there's one stakeholder who can not allow this to take off, it'll be the doctor community if they choose to, right? I think from this conversation, it appears that there are sufficient incentives for the doctor community, but nevertheless, yeah, if there is one group that could, otherwise, I think
I'm going to disagree with you, because at the end of the day, you have to remember your success as a doctor is on me coming to a patient. And if you say, sorry, I'm not going to do telemedicine, I'll go to Sachin. I'm not going to come to you at all. Right. So I think the doctor's ability. So there was a time where doctors could resist this, could oppose it, and they were the ultimate authority. I think that time is gone now, because at the end of the day, the consumer is king. And like Shashank had said earlier on, I can shop around. I can shop around to find a doctor that's going to provide me services that work for me to my convenience. And at the end of the day, I'm going to deliver care.
Adding to it, and I think I should not say that because I'm on the other side of the business now, right? The only way I see a debacle of it, right, is how convenient, simple, safe technology that we provide to a doctor at what cost, right? WhatsApp, Zoom, people are using for their healthcare services nowadays, but is there anything we can evolve in technology which is simpler to use, right? Can it be provided free to doctors to bridge the gap? Can pharma, provide it to the respective doctors of their own? I think that's one thing. If we can, just put up, technology to doctors and they say like, start using it, if not 100%, 5, 10%, 20%, that gradually they can grow, keep on there, because the demand that will receive from the patients, right, might force doctors to use technology going forward. So if technology is there, if basic handholding to a doctor is free, right, and it's convenient, I think it can be scaled up. If not, I see a gray area then, getting used or scaled up with doctors in terms of telehealth.
Yes, I agree with you. I think the 5 A's of healthcare that we've been using forever apply equally to telemedicine. So it has to be accessible, it has to be available, it has to be affordable, it has to be appropriate, it has to be accountable, and of course, the 6th A now that is in fashion, it has to be accredited by the right accreditation authority. So I think if we apply all these A's to the telemedicine solution as well, I think we should do very well. And Sanjeev will be right in his prediction that it's come here to stay with us forever. Uh, Sanjeev, you were saying something.
Yeah, so I mean, if you look at how technology has evolved over the course of the past 25 years, right? I mean, every industry has migrated from being a paper-based to being a digital industry. The healthcare industry is the only industry that has been this transition because the data sets are so complex in healthcare. You have a patient that has multiple systems, that goes to multiple providers, that has multiple diagnostics that come in. So all of these things have taken a long time to kind of figure out. These data models that are behind utilization of technology in healthcare had not been figured out earlier on. They were not as transactional as finance or consumer goods and so on and so forth, right? But I think that shift has happened now. The shift has happened over a period of time, but I think the pandemic has brought this entire technology to the forefront and shown how easy it is to deliver effective care, keeping your 5 A's in mind. It's accessible, it's affordable, because I'm tracking data, my accountability is high, appropriateness can be checked, and which is the fifth one I missed out on?
Accreditation.
And accreditation. And because I have all of this now, I can do an audit on it, and I can accredit the quality of data that you're, the quality of care that you're providing. So I think telemedicine is here to stay.
Wonderful. So, gentlemen, we had about 90 minutes. I really saw the time just now. I don't believe how it has flown away so fast. But we are down to the last 5 minutes, I think, of our discussions before we have to close down. Just want a small and very short opinion on innovation opportunities in telemedicine, right? Till now, we've been discussing just the fact that how do we replace an in-office physical consult with a teleconsult. It's just about replacing something that's been going on for the last thousands of years with hopefully something new. But some thoughts on what are the innovative things that you see that telemedicine can achieve, starting with you, Krishnan, and then maybe going to Sanjeev and Shashank.
That's an excellent question to wrap up this discussion. I think, look, I for one am on the edge of my seat to see who is this next company that's going to be this digital first hospital, right, or a tele first hospital. There is going to be incredible amounts of innovation. I think existing players, uh, they are going to be challenged, I would say. I think, in the current evolution of digital health, they were relatively unperturbed. But I think in the AC version, I would say that, with the right, I truly believe new models will emerge. You can go digital first in the healthcare. So somebody can essentially build out an e-hospital practice and rely on a completely redesigned format of the physical infrastructure. I don't know what that is, but I can imagine a new hospital that comes up servicing that model will look very different than the traditional hospitals we walk into, because the scope of services that need to be offered are fairly limited, very specific, and so on. So I can't wait to see what that is going to be, and I can't wait to. I think there's going to be new companies, new models, and I just want to watch that right in front of my eyes. I can tell you.
Sanjeev, what do you think will be the next innovative model in telehealth being?
So I don't know whether this is innovative as such, but I think aggregation of large amounts of data on the cloud, applying I think will have a huge role to play in delivery of healthcare. I think this and the utilization. So the data will come from a variety of different sources, but the use of sensors to capture real-time data, which allows me to provide effective care, aggregating this data on the cloud over a period of time, not waiting for an illness to occur. And some of this has already kind of started, like in terms of sleep monitoring for people, for people who have sleep apnea. There's sleep monitors that gather data and aggregate this data to predict what is the likelihood of you having an MI over a period of time, right? So I see sensors, I see AI, and I see cloud aggregation of data and those data analytics being a huge component of providing quality care and looking at outcomes as well.
Shashank, your thoughts on the next innovation?
I'll put up a single statement with some two supporting lines into it. I'll say world's largest healthcare has no beds. It's a software, right? That's what I believe going forward. The way we are smart in developing and evolving technology, I think our techies are amazing, right? I think the emerging technologies like portable cardiac and lung monitors, will be able to record real-time, patient data, allowing physicians to access and treat more patients across areas. I think the quantum of technology that we are building up and all those startup geeks which are working, I think, it supports my first line that the world largest healthcare has no beds is a software. I think and we're pretty excited and happy to see that day where we say this everything is on as step one's mission is, that we want to build the online charitable hospital. I think that's the way forward, and hence that's still the future for us.
It's such a wonderful thought to close. I think just like the world's largest transport system has no cars of its own, the world's largest hotel chain has no rooms of its own. So the world's largest healthcare system that I'm sure Shashank will build one day very soon will have no beds. Amazing thoughts. Gentlemen, this has been such a wonderful time and a privilege for me to be here. We've discussed everything ranging from guidelines from telemedicine to statutory liabilities to building a technology platform that will have parallel one-to-one consultations on a large scale. Talked about citizens' social responsibility, the art and science of healthcare, amazing mnemonics AC and BC I've learned today from Shashank. So we are finally in AC now. Some thoughts on the physical examination that you said will be very necessary. I think we saw that a few years ago when somebody said when you go out to buy clothes, the physical touch and feel will be very necessary. How will you buy a dress without knowing what the fabric is? We saw what went of that. So I think we'll be talking about physical examination with some sort of qualification there, whether it is really necessary or not. We talked about hybrid models. We talked about second opinions. We talked about how to incentivize both the community and the doctor. So all, I think, a wonderful discussion which encompassed everything into it. Just one line as a closing thought, gentlemen, and then we'll hand it back to Tech Bharat team. So Shashank, starting from you, you've already given the line of the panel, world's largest healthcare system with no beds, but just one closing thought before we wrap up.
I'll stick to that, Dr. Suchin. I think that's the I'll personally want to see. And second thing, as we say that voting is our birthright. I think accessing and getting reachability to a primary health is also our birthright. I think we all should also think, beyond making money and businesses, we should also think how do we create that impact and create that bridge to the deeper rural villages or suburb parts of our country, because 68 or 70% of our country is rural. I think should a lot of NGOs like and the volunteer efforts like Step One, should people more come up and see how do we can reach out to the last mile. If they cannot reach to a hospital, I think we should reach to them and at least support them in getting a basic primary healthcare. No one should die because he or she couldn't reach out to a doctor. I think that's one thing we should focus on. I think, and technology and our your big leaders like you and mentorship can help us, people like us, to do that and get that dream fulfilled.
Thank you. Thank you, Shashank. Last thought in a line, Sanjeev.
So I think that there's the emergence of the ecosystem in healthcare expanding, where the citizen who's not either the patient nor the provider becomes part of the solution to be able to provide health and public health, thereby improving public health overall of the country. I see that emerging. I'm very hopeful of it. And certainly at step one, we're going to do everything that we can to foster that.
Thank you. Krishnan, last closing line.
Yes. So I will close with step one's mission, which is to create a world where nobody is deprived of healthcare. And I believe for that to happen, telehealth is absolutely essential. And I'm excited to, to see that become a reality soon.
Thank you. Thank you once again, gentlemen, for sparing your valuable time. I know how busy all of you are, but thank you for being with us. Thank you very much to the Tech Bharat team, Arun and Vishu. You've put it all together, this wonderful concept that you've created. So thank you once again, and back to you to close and wrap up things. Thank you once again.
Extremely thankful to you, Dr. Suchin Bajaj, for anchoring this excellent session. My personal thanks to Dr. Sanjeev Chabria, Mr. Krishnan Kasturi Rangan, and Mr. Shashank Saini. It was indeed a very, very incisive and comprehensive deep dive session. We have taken note of all the points, and we would like to pass this on to relevant government authorities. Maybe they will take care of the thoughts that have been shared. Thank you very much once again to the great panel.
Thank you so
Thank
much.
you. Bye-bye. Take care.